welcome back to my channel. My name is Amanda and today's video is all about postpartum essentials. So if you're new to my channel, I'm actually a mum of two and I've got with me today whilst recording my second baby. This is Athena. A couple of weeks ago I've actually done the whole birth vlog and our birth story, so if you want to know about how she came into the world then please watch that. But at the end of that video I did answer some questions that you asked me over my Instagram page. If you're not already following me over on my Instagram, don't forget to go over there and follow me. My tag is Life with Dr. Amanda, and if you're watching this video for the first time, you're enjoying it, please hit the subscribe button and make sure you like and share this video as well. But like I was saying, in that video I answered some questions, and a question that I did get but I didn't have time to answer at the time was to share my postpartum essentials for mom. And I said that I would do a whole separate video on that because there's quite a few to go through, and that's what I'm doing now. So like I said, if you want to see the entire birth story, you can head on over there. But I had a vaginal delivery this time round. It was a VBAC, so a vaginal delivery after a C-section, because that's what I had in my first daughter. And I ended up having a 3rd-degree tear as well. And so there are definitely some things that have helped with my healing. I'm now 3 weeks and 1 day postpartum, and so these are things that got me through the first few days, and also things that I found useful in this that I'm finding useful in the 4th trimester, this period now, and I found useful also when I had my first daughter Isabella 2 years ago. So I've got my iPad here with a list on, and hopefully this one plays ball and she just chills out here on my chest and I can get this video done before she's had enough. So. Okay, so like I said, I had a 3rd-degree tear, and that's, you can look that up, you can Google exactly what a 3rd-degree perineal tear was, but basically I pushed really hard and the area down below I had quite a significant tear, and so these things are things that really help me with that. What I will say is I've had a C-section, and the recovery from a C-section is much longer, I found, from just having a tear, and by about week 2 things were much improved, but that first week was really difficult. And so the first thing that I really found useful was having a perineal spray bottle. Now this is basically like a what they're called again, a bidet, like a handheld bidet, and whenever you're going to the toilet it can sting a lot when you're weeing, especially over like the sutures and the stitches there, and so that just helps to dilute your urine. And also when you're going to the toilet, it's not very pleasant when you've got a tear to just wipe yourself with dry tissue. You okay, baby? Yeah, it's not very pleasant just to wipe yourself with dry tissue. So the perineal spray bottle is great. You just fill it with warm water, you can spray the area and it cleans everything. It cleans your, all the area down there whenever you go to the toilet for number 1, number 2, and then you can just don't have to worry about like using that dry tissue paper over your sutures, which can be really uncomfortable. The next thing that was really important was having a donut pillow. Now it's week 3 now and I'm not using it at all. Oh, that was a big yawn. I think she might be going to sleep soon, hopefully. But it's week 3 now and I don't need the donut pillow at all. I used it all of week 1 and part of week 2, and then it just started, it wasn't as useful to me anymore. But sitting down onto your perineum, onto your suture area when it's really swollen and bruised is really quite uncomfortable. And so having that donut pillow really helped. I took it everywhere. I took it into the car with me. It's the only thing that actually allowed me to get in the car on the way back from the hospital when I was discharged, and so that was essential. What also helps as well is so with your tear you can't really put anything on there, so you're not supposed to use like any creams or anything like that in the first few weeks, and so at the moment I still can't put anything on there just because you don't want to risk getting any infection there. But something that the midwives told me to use and really helped was lavender water, and so you can either buy lavender water or you can use it or you can buy lavender oil and dilute that in water and make lavender water, and basically it really just soothes the area and helps with any bruising. So the way that you can use it, you can soak your area in it in the bath by putting some lavender oil into bath water, or you can dilute it, make the water and then pour it onto your maternity pad, and then that just sits on the perineum and it's really, really soothing. I also got some things from the expert midwife. I got gifted some things by my cousins and my aunt, and there's a spray that you can use. It's called Spritz for Bits. That was really nice and soothing. It stings when it first goes on, but it's actually really helpful. And then also some Epsom salts with lavender and witch hazel that you can put into the bath, and you can soak the area in, and those were really helpful as well. I also mentioned maternity pads. At this point now, 3 weeks, the bleeding's really settled, it's stopped basically. And so you can just use like normal sanitary towels or panty liners. But in those first few weeks, you need the heavy duty pads. And so I use the Lilettes, and I got them from Amazon, and they have the wings and they're huge and they're really helpful in those first couple of weeks. After that, they just feel like you're wearing a nappy when you don't need it anymore. So you won't need it for too long, but those are really, really useful. And also, along with that, the massive underwear. I got mine from M&S and Marks and Spencer's, and they were great. Really comfortable, especially going over the bump. And if you have a C-section as well, you want really, really big underwear that goes over that C-section scar, so you've got nothing sitting on there. Yeah, so those are the things that really help with the perineal tear. Also, with my daughter, I'm breastfeeding again. I breastfed my first daughter for a year, trying it again with this one, and it's going quite well, but there's some things that have really, really helped. First of all, is getting the right kind of maternity bras, and actually you need them for day and night. Most women I think don't really wear bras at night. I certainly don't when I'm not breastfeeding. But in the first few weeks, when you're trying to get your milk supply sorted, you're leaking all the time. Like whenever you feed on one side, the other side's leaking. And so it's really important to have something. You're going to ruin your clothes. Everything's going to be soaking wet if you're not wearing the nipple pad, the breast pads. And to wear this properly, you probably need to have a really comfortable non-wired bra to wear at night time, or like a boob tube or something you can put the breast pads into. And so those are my next two essentials. Then the breast pads, I use the ones from Lanolin, and I'll show you a picture of it because I can't remember right now. But the breast pads, and also getting some really good nursing bras, especially ones for night time. Don't forget those, so you don't soak through all your clothes. Also, with breastfeeding, it can get quite uncomfortable those first couple of days and weeks when your milk's coming in and you're just feeling really engorged. And so you can get, so I think traditionally people use things like cold cabbage leaves from the fridge to kind of soothe the area. And actually I remember my best friend, she was really uncomfortable, and I told her that, and she used some cabbage leaves because she had some cabbage in the fridge at the time, and said it really helped. What my friends bought me on my baby sprinkle though was some breast masks that you can get, and those have been really soothing the days when I've been really engorged. By now my breasts have really settled down, so it's not so uncomfortable, but having something to soothe the area really helps. And also when you're like engorged like that, getting in the shower, I found, in a nice steamy shower, and massaging your breasts and like under your arms as well, because you can get like milk ducts under your arms. That really helps settle things, so that's another essential. Getting something to cool the area, and the breast masks I thought were pretty good. But talking about self-care too, it's really important to do that during this time as well. And so getting some face masks or anything that you find that you can do some quick things that really make you feel pampered, because you can kind of lose yourself in this fourth trimester. And I definitely found that with my first daughter. I didn't do anything to pamper myself. I would say get yourself some things already ready so that you can have a nice face mask on those small moments that you can kind of grab for yourself. Continuing though with the breast thing, now I don't need it so much, and but with both this child, my second and my first, I really found that the first week of breastfeeding is really hard. Even when you've done it before, it's still difficult because the baby's learning as well, and you're learning like a new latch and everything. And with my first child, my nipples are really sore, but they settled down quickly, and I didn't really need much support after that. But I used the Lanolin nipple balm, which really helps to soothe. It's super tacky, it stains your clothes, so make sure you've got breast pads on when you're using that as well. But yeah, the Lanolin nipple balm is great. And this time round she was a little savage, and my like nipples were cracked and scabbed and everything in that first couple of weeks. And so yeah, having the Lanolin really helped. I was very close to using some nipple shields, and I actually purchased some, but the day that they came, things started getting a bit better, and then by like the next couple of days things are better and I didn't have to use one. But remember that those are there too, in case things are really uncomfortable for you. Some people do talk about like the baby getting like nipple confusion and stuff like that with the shields, but really you got to do anything to survive, don't you? And the way that I was in so much pain at the start, if I had them a couple of days before, I probably would have used it earlier. It's just that by the time it came, I was kind of past that point. So if you're breastfeeding, I think it's really important to get a breast pump. Even if you think you're just going to completely breastfeed, and you think you're not really going to use a bottle at all, or you don't want to use one in the first few weeks, that's absolutely fine, but you still need a breast pump, and try and get one before you've given birth. The reason is, like right now, she hasn't taken a bottle, she hasn't tried one at all, she's just over 3 weeks, and to be quite honest, for the first 6 weeks I like to just have her feeding from the breast only, just to really try and help with the milk supply, that she's getting what she needs. And she's like, if we mix them with formula, sometimes it can, your milk supply may not be as great as it could be if you're not just exclusively breastfeeding. But you've got to do what you got to do. I know lots of people that mix and they have no problems, but I really don't enjoy pumping. But if I want to have a little bit of flexibility and I want to have a bit more support, like my husband able to give her a bottle, and so I can pop out, or I can have a nap, or I can play with my older daughter without being interrupted by feeding her, and future, in a few months time, having a supply in the freezer of breast milk, so that I'm able to go on a date with my husband, or pop out with my friends, or just have some time to myself. It's really important to have a pump. But in the first fourth trimester, in the first part of the newborn period, like I said, your breast can get really uncomfortable, and sometimes if your milk comes in as like I have a really big supply, it can be really uncomfortable because the baby can't always clear all the milk off in one feed. And I found it that sometimes she would feed on one side, not on the other side, and I would just be so uncomfortable, and she doesn't need another feed for a couple of hours, and at that point I'd pump. So not pumping for a supply or for anything like that, but just to make sure that I feel comfortable. And so I have done that a couple of times, although she's not had that milk. We've just, put it in the freezer and moved on. But yeah, a pump is essential. I forgot to mention earlier actually about the perineal tear. Store softeners. You need it. Here in England we use lactulose for most people, and I think especially after you've had a tear, whatever degree, I think, and even if you've not had a tear, if you've had a child before, that first poo after labour it feels like you're giving birth again. It can be scary. And with my first child, although I didn't have a tear, I had a C-section. I had lots of different drugs during my labour, which made me constipated. And let me tell you, that first time you go to the toilet, I thought, I don't know, like my life was going to end or something. It was terrible. And so really important to have store softeners. Don't go like too overzealous with them, but have them on hand. Seriously. That was it for the breastfeeding, but there is one more thing. It makes you really dehydrated, and it makes you hungry as well. And so I would say it's really important to get yourself a great water bottle that holds a good amount in there and keeps the water nice and cool. Because especially when you're home by yourself, sometimes you might feel like you're trapped and you can't move anywhere, or you find yourself like, no drink. But if you've got a water bottle that has a lot of water in, that can last you the day, or at least last you the majority of the day, and it still keeps nice and cool in there, have that with you all the time. Also having snacks as well, just dotted around the house, next to the chair where you're breastfeeding, really important, otherwise you will find yourself struggling. Make sure you got your water next to you overnight as well. Yeah, water. I've just got 2 more things left. The next one is, I've been told lots of times that you're spoiling the baby by holding her so much, but I'm a complete believer in that you can't spoil a newborn. And I think it's really important for bonding that you hold your baby if you want to hold your baby. And so I'm someone that does contact naps and I have my newborn on me all the time, as you can see. And so especially now, as I've got another child and a bit more responsibilities than I did the first time round, having a baby carrier and doing baby wearing has been so essential for me. It's the only way sometimes I can get anything done. Fair that I'm only 3 weeks, and there's not that many things that I've been trying to get done, but now my husband's back at work, I need to make sure there's dinner ready, I need to make sure I can do laundry, like there's things that need to get done, and I still want to be able to carry her and have that bond and have a you know, attached to me, and baby wearing is essential. And I've got two different carriers. I've got the Boba wrap, which is like a fabric one, really good to do skin to skin in there. And then I've got the Ergo 360, and that one's like really easy just to snap on when you just need to get going, and it keeps them a bit cooler because it's not so wrapped up. And so yes, get a carrier. And then the last thing is your village. You need it. I know I've actually got a lot of like colleagues and friends that I know that aren't in the situation where they've got a lot of family and friends around them when they're having their babies, and so they're doing it quite solo, maybe just them and their partner, or there's single mums out there. But still, find yourself a village, especially if you're pregnant now. Find some people that you know you'll be able to count on. It may not be that they're able to provide lots of childcare. It may be that they're not that close by, but someone that you can call and speak to when you're really feeling quite lonely, because there can be times when you feel lonely in this whole thing. Someone that you can bounce, just like vent to and talk to about it. And then, you know, if there's anyone that can come and relieve you, even if it's just like sending you a meal, or come and see you, or hold the baby while you nap, or just something, use your village. I'm really bad at like asking for help, but I've gotten much better this time around. And without my village, I don't know what I would do, especially having the two kids now. And so that has been essential to me in this postpartum period. So yeah, those are my postpartum essentials. The baby's gone to sleep. Perfect, as the video finishes. But thank you so much for watching. I hope you found it useful. Leave any questions that you have down below, and like I said before, if it's been useful and you've enjoyed it, please go ahead and look at my other videos. I've done a birth story, like I said, and also I shared the first week with a newborn as well. And so please go over and check those out, and if you enjoy, subscribe and share with your family and friends. Thanks for watching. Bye.